Assalamu alaikum. I am Dr. Abdul Wahab, Associate Professor, Department of Pharmacy, Kohat University of Science and Technology. I am instructor for the course Community Pharmacy, and our today topic is patient education and counseling. That how to counsel the patient. So, in our today discussion outlines, we will first define patient counseling. Then we will discuss objectives of counseling, and we will also try to describe techniques of counseling and communication skills in patient counseling, environment during counseling, counseling process steps. So these are the different headings you can see over here for our today topic. We will try to discuss all about these different topics or headings you can see, as you can see over here. So first of all, I would like to define counseling. That what is counseling? Patient counselings may be defined as providing medication, information orally or in written form to the patients or their representative. Representative means caregivers. Or we can also define the patient counseling providing proper directions of use, advice on side effects, storage, diet and lifestyle modifications. It is the second definition of patient counseling, and we can also define the patient counseling as the provision of advice on therapeutic matters to patients or member of healthcare team. So these are the different definitions of patient counseling. In patient counseling, it involves a one-to-one interaction between a pharmacist and patient or a caregiver, means a representative from patient sides. The effective counseling should encompass all the parameters to make the patient or any other party understand his or her disease, medications and lifestyle modifications if required. Objectives of patient counseling. What are the different objectives of patient counseling? The first one, to bring awareness in patients regarding importance of medication for their well-being. It is the first objective of patient counseling. The second one is to establish working relationships and a foundation for continuous interactions and consultations. Working relationship between patient and pharmacist, between pharmacist and other healthcare team member. The third objective of patient counseling is to improve patients' understanding of strategies to deal with medication side effects and drug interactions. And it is also the objective of patient counseling to ensure better patient compliance. On the basis of patient counseling, a patient becomes an informed, efficient and active participant in disease treatment and self-care management. And it is also the objective of patient counseling to prevent drug interactions and adverse drug reactions. So these are the different objectives of patient counseling. Okay, now we would like to discuss the contents of patient counseling. The content of an education and counseling means patient counseling session may include the information as listed below: the medication's trade name, generic name, common synonym or other descriptive names, and when appropriate, its therapeutic loss and efficacy, the medication's use and expected benefits and action. This may include whether the medication is intended to cure a disease, eliminate or reduce symptoms, arrest or slow the disease process, or prevent the disease or a symptom. And the content also include the medication expected onset of action and what to do if the action does not occur. Fourth one, the medication's route, dosage form, dosage and administration schedule, including duration of therapy, directions for preparing and using or administering the medication. This may include adaptation to fit patient's lifestyle or work environment, action to be taken in case of missed dose, precautions to be observed during the medication's use or administration, and the medication's potential risks in relation to benefits, potential common and severe adverse effects that may occur, actions to prevent or minimize their occurrence, and actions to take if they occur, including notifying the prescriber, pharmacist, or other healthcare providers. So these are all the contents of patient counseling, like potential drug or drug food and drug disease interactions or contraindications. So being a community pharmacist, it is your responsibility to give information, to counsel the patient all about the potential drug interactions, drug food interactions, and drug disease interactions or contraindications. So you should brief the patients all about such type of interactions during counseling process, because these are the contents which are included in patient counseling process. The medication's relationship to radiologic and laboratory procedures, timing of dose and potential interferences with interpretation of results, instructions for 24 hours access to pharmacist, proper storage of the medication. Being a pharmacist, being a community pharmacist, being a clinical pharmacist, being a hospital pharmacist, it is your responsibility to guide the patient properly about the storage of the medications, and also it is also your responsibility to tell the patient about the availability of the pharmacist. Similarly, proper disposal of contaminated or discontinued medications and used administration devices. Being a pharmacist, it is your responsibility to guide the patient all about such type of activities. Any other information unique to an individual patient or medication. If there are other information which are related to the patient or medication, should be communicated to the patient during counseling process. know the different techniques which are used during counseling process. Like, there are several techniques which can be adopted for effective counseling. Some of them include providing written information to the patient and the use audio and visual materials. These are used during counseling process, and it is the technique uh, for the counseling process. Similarly, the use of various compliance aids include labeling, medication calendar, drug reminder chart, and providing special medication containers and caps can also be adopted. The United States Pharmacopoeia (USP) Medication Counseling Behavior Guidelines divided medication counseling into 4 stages. Like, in stage number 1, you can see medication information transfer. Stage number 1, medication information transfer, during which there is a monologue by the pharmacist providing basic, brief information about the safe and proper use of medicine. Okay, the second stage is medication information exchange. The first one is medication information transfer, and the second one is medication information exchange, during which the pharmacist answer questions, asks questions, and provides detailed information adapted to the patient situation. Stage 4, medication education. Medication education, during which the pharmacist provides comprehensive information regarding the proper use of medicine. Regarding the proper use of medicine. It is the third stage of uh, patient education counseling technique according to United States Pharmacopoeia. The fourth one is medication counseling, during which the pharmacist and patient have a detailed discussion intending to give the patient guidance that enhances problem solving skills and assess with proper management of medical conditions and effective use of medication. Communication skills in patient counseling. Communication skills in patient counseling. As we can define the communication, communication is the exchange of information, ideas, thoughts, and feelings. It is the definition of communication. So, pharmacists should use proper verbal and non-verbal communication skills during the counseling session. Communication is the important step in patient counseling. So, the pharmacist should use proper verbal and non-verbal communication skills during the counseling session. Studies repeatedly show that the effective patient counseling can significantly reduce patients' non-adherence, treatment failure, and wasted health resources. The counseling pharmacist should be well dressed so that the patient feels that the pharmacist is a professional one. So, for the professional look, it is your responsibility to wear well lab coat, and you should be well dressed. The nature of the counseling should be modified to the patient population. A good counselor is one who listens to the patient carefully and share the problems closely so that the patient expresses the emotions underlying the disease. During counseling, pharmacists should be totally involved in counseling and should not be half-minded. Even attending a telephone call while counseling may affect the quality of counseling. So therefore, being a pharmacist, during counseling process, you should avoid to attend the call. You should focus on the patient's questions, and you should not distract your attention, uh, and effective counseling will end up with several questions being asked by the patient. Throughout the counseling process, the pharmacist should avoid jargons and slang expressions. Clear? Environment during counseling. Education and counseling should take place in an environment conducive to patient involvement, learning, and acceptance. Individual patients, groups, families, or caregivers should pursue the counseling environment as comfortable, confidential, and safe. Education and counseling are most effective when conducted in a room or space that ensures privacy and opportunity to engage in confidential communication. If such an isolated space is not available, a common area can be restructured to maximize visual and auditory privacy from other patients or staff. Patients, including those who are disabled, should have easy access and seating. Space and seating should be adequate for family members or caregivers. The design and placement of desks and counters should minimize barriers to communication. So these are the basic elements which are required for the favorable environment for counseling. So these are the different points. Being a pharmacist, you should keep in mind all about these points during counseling process, and I mean that environment should be favorable for the patient. Distractions and interruption should be few so that the patients and pharmacist can have each other's undivided attention. Means there should be no distractions, no interruptions for the proper counseling, because if there is distractions and interruption, it will affect on the communications between pharmacist and the patient or the caregiver or any other health care member. The environment should be equipped with appropriate learning aids, for example graphics, anatomical models, medication administration devices, memory aids, written materials, and audio visual resources. These are important for the proper communication. If there is proper communication, clear communication, then the counseling process will be successful. So, counseling process steps. So there are different steps. Steps in the patient education and counseling process will vary according to the health system's policies and procedures, environment, and practice settings. Generally, there are some steps which are appropriate for patients receiving new medications or returning for refills. As you can see over here, it is the first step. Introduce yourself as a pharmacist. Okay, it is your responsibility that during counseling process, it is the first step, as you can see over here, that you should introduce yourself as a pharmacist and explain the purpose and expected length of the sessions and obtain the patient's agreement to participate. Means patient participation is must. So before going to start the communication process, the counseling process, you should try to agree the patient to participate in counseling process. Determine the patient primarily spoken language. You, being a pharmacist, should ask the patient about the spoken language. Second step, access the patient's knowledge. Access the patient knowledge about his or her health problems and medications, physical and mental capability to use the medication appropriately. It is the second step for the counseling process. So you should, being a pharmacist, should try to know about the knowledge of patient regarding the problem, regarding the disease, and also about the medications. So it is the second step. Ask open-ended questions. Open-ended question about each medication's purpose and what the patient expects, and ask the patient to describe or show how he or she will use the medication. Okay. Patients returning for refill medications should be asked to describe or show how they have been using their medications. Understand? They should also be asked to describe any problems, concerns, or uncertainties they are experiencing with their medications. Means you can ask the patient if they come for refilling of the prescription. So during this stage, you can ask all about the side effects, the contraindications, adverse drug reactions, about the medications, about the use of medications, and all those concerns which are related to the disease or the medication. So it is the responsibility of a pharmacist. Third stage or step, you can see over here, provide information orally and use visual aids or demonstrations to fill patient gaps in knowledge and understanding. Open the medication containers to show patients the color, sizes, shapes, and marking on oral solids. Demonstrate the assembly, means the devices which are used with the packing materials, packaging, and use of administration devices such as nasal and oral inhalers. As a supplement to face-to-face oral communication, provide written handouts to help the patient recall the information. If a patient is experiencing problems with his or her medication, gather appropriate data and assess the problem. It is, being a pharmacist, it is your responsibility. If you are working on the community pharmacy, or if you are working in hospital as a hospital pharmacist or clinical pharmacist, these are all your responsibility. The fourth step is verify patient knowledge and understanding of medication use. Ask patients to describe or show how they will use their medication and identify their effects. Observe patient medication use capability and accuracy. Information include in counseling name and descriptions of drug, dosage form and route of administration. Name and description of drugs, dosage form and route of administration. Being a pharmacist, it is your responsibility that during counseling you should guide the patient all about these parameters like name and description of drug, dosage form and route of administration. And during counseling, it is also important to guide the patient that how to take or use the medicine, how to take or use the medicine, when to take or use medicine, how much to take and use the medicine, how long to continue to take or use, what to expect, immediate relief, no effect for several days, why the medicine is being taken or used, what to do if something goes wrong, how to recognize side effects and to minimize their incidence. Lifestyle changes need to be made, proper storage and refill information. Thank you so much. It was all about the patient counseling. Inshallah, we will try to discuss in our coming lectures all about the contents which are included in our syllabus, like alternative medicines, layout design of community pharmacy, etc. Thank you again. Stay blessed. Allah Hafiz.